So we know that currently there's more than a dozen strains of COVID-19. The WHO has decided to name these strains based on the Greek alphabet. And so the Omicron, which is the newest one, I believe is the 15th letter of the Greek alphabet. So they did skip two, one because it was new and they thought you would say new COVID as opposed to the letter. So we know there's at least 13 going around. The differences that we've been seeing so far between Delta and Omicron are that Omicron appears to be very, very much more transmissible than the Delta. And this is shocking to us because Delta was much more transmissible than Alpha and Beta. But the Omicron is a whole new level of transmissibility. So we are seeing a doubling rate in Omicron of 3 days, which is very, very rapid. The WHO breaks all the variants into different labels. And so the Omicron is a variant of concern. And what this means is that it has the potential to cause more human harm. And that can be from a whole multitude of reasons. So it could be more infectious, it could be more severe, it could evade our vaccines. But whenever they see a variant that has a potential for that, they name it a variant of concern. Some of the anecdotal evidence that's coming out of South Africa and the UK has shown that this tends to have less loss of sense of taste or smell compared to the Delta variant, and also some milder symptoms. And so people are saying instead of a sore throat, they're having more of a scratchy throat. But otherwise, the symptoms are pretty similar. They're cough, they're shortness of breath, sore throat, headache, myalgias, etc. So unfortunately, RNA viruses like COVID they mutate. This is what they do. And so it's going to continue to mutate. What we have to look for is trying to stop that mutation. And how do we do that? And so we do that by getting vaccinated, because what makes RNA viruses mutate is the more times that they replicate. And we know that they replicate less in people who are vaccinated. And so if everyone were to get vaccinated, there would be less replication and less chance of mutants coming out. Unfortunately, we're not in that situation because so many people have not been getting vaccinated. And that's why we're seeing these mutations come very frequently.